Tens of thousands of people are locked up in ICE detention facilities across the country in conditions ideal for a massive and deadly outbreak of the coronavirus. In mid-March, public health experts warned that Immigration and Customs Enforcement needed to take aggressive steps to thwart a disastrous outbreak of COVID-19 in its facilities. But months later, many say it has become clear that ICE did not heed those warnings. Now, its publicly confirmed infections are rising at an alarming rate. Over the past few weeks, I've been in contact with several ICE detainees across the country. Some of them agreed to speak on video call, while others asked not to be recorded out of fear of retribution. But one thing that was similar in all of these conversations was their palpable sense of anxiety, that outbreaks in their facilities were inevitable.
We are here fighting so bad to get out, because especially now with this coronavirus, we're really scared and here.
Because we're like rats trapped in a cage. If one of us gets sick, we're all bound to get sick.
What is it about ICE detention facilities that make them particularly vulnerable to these types of viruses?
In a word, these are what they call congregate settings. There's a lot of people collected in a close setting. So that is the major problem, not just for the people that are detained there, but clearly a problem for the staff that has to work there as well, putting their families and their own communities at risk for when they leave their facility.
Dr. Josiah Rich was one of the public health experts who came forward in March, trying to warn of a potential tinderbox scenario in ICE detention centers. He is being represented as a whistleblower by the Government Accountability Project.
The measures that we as a world have put together to prevent this have been primarily what they call social distancing, staying 6 feet apart from each other. But you can't do that in these facilities. There simply is not 6 feet to be apart from each other. Everybody has to use the same bathrooms, the same showers, the same dining halls.
We don't really necessarily keep the social distancing, as you can see. Most of us are together.
It's our bed, all that right down back there, it's our bed, and the table is here. So that's where we eat.
Once this virus gets in, it will spread very quickly.
Since our interview, Dr. Rich and other medical experts conducted a study with troubling results. Under the best case scenario, they found that 72% of those in ICE custody will become infected. And for the worst case scenario, they say nearly 100% will be infected by the coronavirus. How has ICE handled, the COVID-19 crisis?
ICE has not tested very many people, and ICE has not released very many people. There have been a number of complaints from people on the inside about conditions. They don't have access to basic cleaning supplies, to basic medical supplies.
We don't have the disinfectant, the hand sanitizer. We don't have any of that.
We have to bring our own soap to shower.
You have to bring your own soap?
Yeah, like buy our own soap from commissary.
You have to buy your own soap from commissary?
Yes.
So they're not providing any additional cleaning supplies? As of May 4th, ICE claims it has released over 900 detainees because of the crisis. But that is still only a small fraction of the nearly 30,000 currently in custody.
When you look at a kind of growth curve for the numbers of cases they're reporting, it looks like this, right? Like it's only in a few weeks that we see a kind of straight line going up. And so what that suggests is if they tested a lot more people, there are likely many more people who are positive.
If you're feeling sick, how are the doctors there? How are the nurses?
You have to put in a call at sick call. So you have to get up at 5 in the morning and go out to the facility and see if you will be seen. Usually there'll be a couple, 50 to 60 members lined up waiting to see a doctor. It usually takes about 4 to 5 hours to see a provider.
There is 2 women in here that they feel sick. They feel like fever. Their body is all sore and they are being coughing. They haven't had the test for a coronavirus because I don't think they have that in here.
As of the recording of this video, ICE has not responded to our request for comment. Now, it's really important to point out that everyone in ICE detention is there for civil immigration violations, not because of any crimes they may have committed.
We shouldn't be making an argument that anybody needs to be in detention for safety reasons. These are all people being held to induce their appearances in immigration court. That's the purpose of detention. And people do show up in court when they're not in detention. We don't need detention to ensure that they do.
The US has a long and complicated history of detaining immigrants, but the massive centralized detention apparatus that we have today wasn't really a thing until pretty recently.
The real turning point was in 1996. Bill Clinton was the president. He signed into law what we call IRA, the Illegal Immigration Reform and Immigrant Responsibility Act.
This administration has taken a strong stand to stiffen the protection of our borders.
And that law set in motion a massive overhaul in how immigrants were detained in this country, as well as who is detaining them and why.
There's been a tremendous privatization of detention. And so that means that the majority of people who are detained by ICE, by the government right now, are in private detention facilities, not in facilities run by the government. And so they're for-profit institutions.
We're just here at the government's expense for a pro-profit private organization that just benefits from our being here.
We all like a number in here for them, you know.
And we just want everyone to know that we're struggling too. We're humans.
I'm a single mother, and I'm more scared also about my kids being in here. It's really, really stressful because you don't know what to do.
If ICE continues on its current policy of not releasing any significant number of detainees, what should we expect to see?
Well, unfortunately, we're going to see a lot more deaths. We're going to see a lot more people getting sick. We're going to see people flooding out into local healthcare facilities, and unfortunately, probably overrunning some of them. But in ICE, we have one agency that could make a decision. We're just going to let out a large number of people in order to slow this impending disaster. But unfortunately, that doesn't seem to be the case yet.